Meeting of the New York City Health and Hospitals Audit Committee. Today's meeting is officially called to order. First, I would like to propose a motion to adopt the minutes of the Audit Committee meeting held on July 1st, 11th, 2022.
So moved.
Okay, all those in favor? Everybody?
Aye.
Thank you. Now, I'd like to propose a motion to convene an executive session to discuss confidential and privileged matters that may be related to threatened and potential litigation. May I have a second?
So moved.
Sec-
Yeah.
Second.
Okay, all in favor?
Aye.
Aye.
Let's go to executive session.
Do we leave?
No, we stay.
Oh,
They
she
stay.
got up to leave.
Oh, I don't know why she does.
Do we leave?
Oh, we go somewhere else?
Yes.
Oh, I thought that we stay here. You were right, Rita.
Okay. Now we are going to have a presentation of the fiscal year 2022 draft financial statement by John Olberg and David Guzman.
Good morning. So it's my honor to present for review the fiscal year 22 financial statements for health and hospitals. In reviewing the financial statements, there are significant changes year over year that I want to call to your attention, and I'll kind of walk you through some highlights.
Okay. Okay. Oh,
So let's start here. Sorry. I don't know how to make this kind of. All right. So the first item I want to call to your attention relates to the fact that the corporation's net deficit position improved in fiscal year 22 by $957 million. And that's comprised of different factors. So I'll turn to the attention of revenue, which is the first item in the income statement. So revenue increased in 22 by $1 billion. That's largely driven by a UPL conversion revenue that we received. We received $638 million from prior year in 22 and $447 million in current year. So that drove the increase. When we look at the different
My apologies
categories,
for interrupting, but we can't hear anything.
oh,
I'm still muted.
I can hear you now. Thank you.
Sure, not a problem. So good morning, everyone. So it's my honor to present the 2022 fiscal year financial statements for Health and Hospitals Corporation. I'm going to start off by walking the committee through some significant changes that we're noting in the financial performance of the corporation as we compare this year versus last year. So the first thing I want to call to the attention of the committee is that overall the corporation's net deficit position improved by $957 million in fiscal year 22. And I'll go over the categories that are driving that performance change. So starting with revenue, the corporation's revenue increased by $1 billion. That's driven by UPL revenue that we received in 22. We received $638 million of UPL conversion revenue for prior year and $447 million in the current year. Going to different categories within revenue, we also have net patient service revenue, what we call NPSR. That increased by $137.9 million. In consideration of the significant increases due to the Medicaid UPL conversion funding that I just referenced, the system took a conservative position and reduced its Medicaid DISH estimate by $596 million. We anticipate a reconciliation process which occurs in a 3-year lag to true up the number in actuality.
I'm sorry, where is the reduction for the DISH revenue? How is that reflected?
It's actually in the revenue and net patient service revenue.
Okay, so you reduced that?
Yes.
Okay.
In terms of the appropriations revenue, increased by $342 million, mainly due to an increase in cash received from the city for debt service, which is not being obligated for payback, unlike prior year. In terms of grant revenue, we did see a decrease of $112.6 million, mainly due to a $101.9 million decrease in VBP QIP program revenue. It is worth noting that in the prior year, we had recognized 2 years' worth of VBP QIP revenue due to the timing of the contract execution. Other revenue line increased by $6.8 million, largely due to increased ACO revenue in the current year. Turning to the other side of the equation, which is the expenses, they increased by $90.7 million. $70 million is coming from personal services, mainly due to staff nursing or emergency overtime usage. Other than personnel services, decreased by $256.7 million, primarily related to pandemic expenditure decreases. Our pension costs increased by $290.5 million, and post-employment benefits, other than pension, which we call OPEB, decreased by $195.7 million due to changes in actuarial calculations as calculated by the New York City Office of the Actuary. Affiliation contracted services increased by $155.4 million due to contractual increases and estimated contract settlements. Depreciation increased by $26.6 million, due mainly to continued spending for EITS purchases during the year. There were changes in other net position, which increased by $26.8 million. That's comprised of capital contributions funded by the city, which increased by $17.3 million, as more projects were funded by New York City for capital projects when compared to prior year. And capital contributions funded by grantors and donors increased by $9.5 million due to FEMA mitigation and capital restructuring financing program, CRFP, funding. So all told, when you compare revenue and expenses, the corporation's net deficit position at the end of the year decreased by $1.46 billion. I'll stop there if there are any questions.
Just a quick question. Is the PAGNY settlement included in the affiliation contract, or that'll be this fiscal year?
That's, it is in the affiliation number. I believe it is in the affiliation number.
Okay, thank you. Any questions?
I had one question on the city contribution and the debt service reimbursement, or forgiveness, I guess?
Yes.
And David, I think you mentioned it was a cash receipt, so did we pay the debt service and then they paid us cash back? I thought it was just that we didn't have to pay the debt service.
Right. So you want to explain this, James? So 212 of the $342 million is the city in turn picking up our debt service costs.
Okay. So it's not actually a cash movement, it's sort of recognized. So we recognize the expense of the debt service,
Yep.
and then it's offset by the city having
The 212 million was prior year, so.
contributed. Got it.
Yes.
Okay,
So that's the effect of the one time.
right.
Yeah.
And then on the VBP QUIP decline, David, you mentioned that there was prior years we had recognized revenue. Is the decline this year an adjustment from revenue that we didn't end up getting that we had recognized earlier, or is something else?
We got 2 years.
Last year.
We got 2 years last year, and there's no more collections of EBP QUIP, so it's just a reflection of 2 years and then going back down to zero. Is that right? Yes.
So I mean, this is probably not the right terminology, but the 2 years that we recognized last year was kind of a cash recognition, like we received the money, but it was really for this year? Is that? Or not?
I'm not sure about the exact year, but it was basically due to the timing of the contract extension. That's why we had received it. We recognized 2 years worth of VBP QUIP monies.
Okay, so it was higher last year, and then there's a decline
Yes.
this year, and is it over? We're not
It's
getting it?
over,
Yeah,
right? It's over. Yep.
Okay, thank you.
Are there any other questions? Okay. If not, we're going to have a presentation of the Grant Thornton fiscal year 2022 report by Lou Forstein.
Great. Thank you. Good morning. I'm Lou Feuerstein, the Managing Director with Grant Thornton. We've got an annual audit presentation. You may have that in front of you. I don't know if it's on the screen yet. Those are the financials. It won't be that file, but I'll go through it. I'm not going to go through every page, but just highlight some of the more important items. On page 1, just to kind of lay the groundwork, set the table, if you will. What are our deliverables? Separate audited financial statements on New York City Health and Hospitals for the year ended June 30th, 22. For that same year end, there'll be audited financials on the ACO, the Accountable Care Organization, Metro Plus, your insurance company with the same year end, gets a set of audited financial statements. And then there are two other financial statements that are prepared as of calendar year end rather than fiscal year end to meet statutory requirements. One on Metro Plus Health Plan, and then a statutory financial statement for Metro Health Plan. One GAAP, one statutory. There's two cost reports that get filed each year, and then a management letter that we prepare each year. On pages 2 and 3, just defining responsibilities. Grant Thornton's responsibilities to perform an audit in accordance with United States generally accepted auditing standards and also government standards, and for ultimately opining on the fairness as to the financial statements. On page 3, those charged with governance really have an oversight position to make sure that the external auditors and management are fulfilling their responsibilities. Management's responsibility, they're really responsible for preparing the financial statements, establishing a sound system of internal control, keeping us informed on happenings during the year, and then again, those charged with governance make sure both of those parties are meeting their responsibilities. On page 4, this is probably the third year we've had these COVID considerations. So we added some additional audit procedures to make sure that various impacts of COVID, be it for reimbursement programs, but for perhaps other losses or disclosures of uncertainties get included in the financial statements, and really nothing new to report here this year. On page 5, the auditors are responsible to perform additional procedures to ensure the risk of fraud is low. Those procedures we do each year include interviews with both financial, non-financial people to ask the question as to whether or not there's any concerns for misstatements or fraud. We perform extensive audit procedures in that regard, and there were no matters that came to our attention in regard to fraud for this year's audit. Page 6, we're essentially finished. We've got a little bit more work in some specific areas of testing, but really the biggest items left to do is just to have our quality review folks review our work papers and the financial statements. Page 7 starts somewhat of a lengthy list of areas where we spend some additional time and effort. Why? Either they're higher dollar amounts, they're subject to estimation, they're subject to management's judgment, and so areas like accounts receivable, net patient service revenue, related contractual allowance, bad debt reserves, we spend a lot of time in the audit in that area, reviewing reconciliations, analytical procedures, testing write-offs. We also do extensive work on cash realization, looking at your prior year receivables and see were they collected in the current year. And then we look at the current year ending receivables and see how well they're collected subsequent to year end. So we get a good feel of the reasonableness and collectability of the net accounts receivable. On page 8, we also spend a lot of time in what's called estimated settlements with third-party payers. What are we talking about? These are settlements essentially with Medicare and Medicaid. Funds are often advanced and then reconciled to specific reports and information. So we make sure that cost report information, other items that get calculated on an estimated basis get trued up and finalized, and that sets up our either receivables or payable with Medicaid, Medicaid, and certain other payers. A very well controlled area. The folks do a good job in that area, and we have no concerns. These are big numbers, but very well maintained. And I would add a very consistent conservative position. This is a place where you take a step back and say, you know, we might be entitled to X, but we're not sure that Medicare is going to accept this and that, so let's back off a little bit. So they're conservative, and there's documentation and rationale for coming up with those conservative estimates, which is, as a board, as an audit committee, that's what you want to hear. You want to make sure that you're not aggressively over pursuing these third-party reimbursements, but that you're reporting a fair amount. I'll flip a couple of pages. I know we talked about the pension benefits. Just on item 11, just quickly in passing, we do spend a lot of time in grant revenue, and that's because it's a big number. We get the documentation, we go back to invoices, we support the numbers. And again, it's an area of emphasis that we spend a lot of time, and I'll be talking about grants just in a couple of slides down the road here. Flip ahead. There's one thing that I'd like to point out on slide 14. Grant Thornton, as an auditing firm, do things a little bit different than perhaps some other firms. So one of our procedures is called whole ledger analytics. And what we do is we download the entire general ledger, all of the transactions, the hundreds and thousands of transactions, and we put that information through our own proprietary, in fact, trademark software, where we look at every single journal entry and rate it and compare it against 30 some odd algorithms to see whether or not there's some propensity for that entry to be appropriate or not appropriate. So in the old days, we would test 25 journal entries and look at the backup and say, yeah, these look good, randomly selected. But you don't get a lot of coverage that way. So this is really a 100% test of the transactions of the general ledger to make sure that there's nothing large or unusual, and items that appear large or unusual, then we go back and investigate those. On page 15, just a slide on our insurance practice. So you should be aware there's really two different Grant Thornton audit teams. I lead the audit of the hospital and related entities, and then we have an insurance practice that does Metro Plus. We spoke with them, and that work is substantially complete. There's no issues, there's no problems. They spend a lot of time on the two areas that are listed here on page 15. Claims payable, what's IBNR, incurred but not reported. So you've got some claims that the organization's aware of, but then there's folks that are seeking services, medical, they're in the hospital, that even the insurance company isn't aware of it yet. So there's liabilities that are recorded for the known and the unknown. Certain amount of estimations in there. We go back and see how good the estimates appear a year later. And again, a very well-controlled, managed company. No concerns there at all. And same thing with premium revenue. We make sure that the revenue agrees with the ultimate payments, that it ties into the amounts that should be reimbursed from the payers. And again, no concerns there. On 16, we have a separate team that takes a look at your information technology. Our work, though, is limited as to how it ties and relates to the financial statements. So we look at program access, program changes, and insofar as it relates to the financial statements, determine whether the controls are adequate. And there, we're happy to report no concerns, no issues. There's some required communications that begin on 17 and 18. Again, I won't go through each one of them. To point out on 18, no new accounting pronouncements were adopted, but I think next year we probably have to adopt the lease accounting. That'll start July 1st. And what that will do is take your operating leases that are just typically explained and disclosed in a footnote and put those on the balance sheet as a right-to-use lease asset and a lease obligation. So that'll happen at the beginning of this fiscal year for 2023. On 19, materiality, as you can imagine, we don't test 100% of all the transactions of all the accounts, so we base it on materiality. That number for the New York City Health and Hospitals is a function of percentage of revenue, and for Metro Plus, it's a component of their surplus. As I mentioned, on top of 20, no fraud, no irregularities, no concerns there. One last item I'll cover is on the last item on slide 20. We did note and will report a material weakness in internal control relating to grant income recognition. An adjustment was required to correct the grant income accounting, and because of that, we've determined it was a material weakness. Again, not so much on inappropriate grant expenditures, but really the timing of grant income recognition that triggered a correction. And another important item, top of 21, no audit differences. In other words, other than that one adjustment for grants, there were no other recorded or unrecorded adjustments. And maybe I'll stop and see if any questions. I know I went through it kind of quick, but kind of hit the highlights.
Any questions? Okay, hearing no questions, I would like to propose a motion to accept the financial statements as presented. Do I hear a second?
Second.
Okay, all in favor, say aye.
Aye.
Okay, the motion is adopted. Next, we'll have an audit update.
Good morning, Karen Wilkinson, and for Catherine Patsos, the Office of Corporate Compliance. First up is the New York City Comptroller's Office audit of the nursing homes medical surgical supplies inventory. This was earlier in 2020 at the start of the pandemic. On June 29, 2022, we had a final audit report issued. The report made 4 recommendations, which the system agreed to implement. Those recommendations are, you got it, okay. Those recommendations are below or in front of you. On September 30th, 2022, thank you. Chair of the board received an audit notification letter from the New York City Comptroller's Office requesting a status report of those recommendations. And the status report is due by October 31st, 2022. The second item on the internal audit agenda is the New York State Office of the State Comptroller. Follow up on the equipment controls. The State Comptroller previously conducted an audit of the system controls over its equipment, which was covered between July 2016 and August 2018. This review is a follow-up to that audit. On August 30th, 2022, a preliminary entrance conference was held between New York City Health and Hospitals and OSC auditors. The OSC requested a number of documents prior to that entrance conference and also requested a recommendation implementation status of those recommendations made in the original audit. The auditors are making site visits to our facilities, and that is ongoing. Internal audit activities.
Just a quick question. Do you expect they're going to visit all of our facilities or just doing a sampling?
Just a sample, is that correct?
Okay.
Just a sample. They're not going to basically go to all the facilities. What they're doing, they're looking at, it's a follow-up, so they look
Right.
back at the original audit,
Mhm.
and then they judgmentally pick some equipment, and they're going to the site to make sure that those equipments are actually there.
Okay, thank you.
Some internal audit activities are system-wide review of nurse hiring. This was initiated back in November of 2021. It was requested to put on hold because of some documentation that was due to the New York State Department of Health at that same time. The field work has resumed, and internal audits is currently reviewing documentation for agency nurses in the agency's vendor management system platform, also called WAND. And the auxiliary audits, New York State Charities Bureau requires that a review, compilation, or audit report accompany the CHAR 500 New York State tax form submitted by the auxiliaries. It's based on the total annual revenue of the auxiliary. 22 reports have been drafted for calendar year 21, and the Office of Internal Audits has reviewed and finalized 12 of those 22 reports. 11 of them were compilations of the auxiliaries' revenue, which were below 250,000. One was a review of the auxiliaries' revenue between 250,000 and 750,000. 2 of those reports remain outstanding for calendar year 2020, which was the North Central Bronx and Queens Hospital. 1 report has been completed for each of the calendar year 2018 and 2019 for Queens Hospital. These reports had been pending determination from the IRS of the retroactive 501c3 status, which was confirmed. And then you have the chart of those audits on the last page.
Alrighty. And
Any other questions on that?
final item,
Ellie, I'm sorry, before we move on, could I just make one more statement on the financial statements?
sure.
I'm fine with the accepting of the financial statements. I just wanted to note that, we hadn't had a real chance to digest everything.
Right.
So, there were some findings that Grant Thornton talked about that at some point we will want to come back and discuss. So,
Absolutely. So we're going to make
And I will
provision.
agree with that. I will agree with that.
Okay, we'll make provision for any questions that might exist on the financial audit.
great, thank you.
Thank you.
And now we're going to have a compliance update. Sharon?
Thank you. So, we are required to conduct exclusion and sanction screening for the reporting period of June 16th through September 28th, 2022. There were no individuals or entities that appeared on the OIG or OMIG exclusion list. There are also no providers identified on the DMF or NPP enumeration system during that same reporting period. So the top of the third page, thank you. So for privacy incidents and related reports, during the period of June 16th through September 28th, 2022, there were 78 incidents entered into the case management system. Of those 78, 41 were found to be violations, 16 were found to be not violations, and 21 are still under investigation. Of those 41 incidents confirmed as violations, 22 were determined to be breaches. 12 of those were the result of registration errors. 2 involved a workforce member accessing the record of a family member. 2 resulted from the system's release of information vendor releasing records to the wrong patient. 3 involved workforce members accessing the records of patients without a work-related reason. 1 involved a workforce member inappropriately disclosing an HIV status to law enforcement. 1 involved a physician disclosing test results to a family member without patient authorization. And 1 was the result of granting a parent the wrong level of access to the patient's MyChart account.
You have a question?
Yes?
In the one with respect to releasing information to law enforcement, how is that, or do we know how that came about, and how are there protections in place for that particular type of access?
A workforce member had inappropriately contacted law enforcement to notify them that a patient was at our facility that should not be present, and they also disclosed HIV status.
Okay. But is there any learning that we have from that on how to address these issues for the future?
Absolutely. We've retrained that workforce member, but we've also working with hospital police, HP, to instruct them what information we can disclose and who to contact when we need to disclose certain information.
Thank you.
Of the 43 privacy incidents that were reported during the July 2022 Audit Committee meeting, 25 were still under investigation at that time. Currently, 24 of those incidents have closed. Of those, 20 were found to be violations. 4 were found to be not violations. Of those 20 that we found to be violations, 8 were determined to be breaches. 4 were the result of registration errors. 1 was the result of an emergency room doctor providing the wrong after-visit summary. 1 the result of the workforce member accessing the record of a family member. And 1 was the result of an HIV diagnosis being disclosed to a family member without authorization. And finally, 1 was due to an inappropriate access of a workforce member to a patient's record without a work-related reason. The OCC did not receive any letters from the OCR during the reporting period. And during the reporting period, there were a total of 85 compliance reports entered into the OCC's tracking database. Of those, 1 was a red report, 46 were yellow, and 38 were green reports. That 1 red report involved a nurse who left her shift without giving a patient their medication, and this was referred to the facility's chief quality officer. On the following pages, you have the various charts and graphs of the compliance reports submitted during the reporting period. Finally, on the bottom of page 8, billing and coding auditing services. The OCC, in collaboration with the Office of Revenue Cycle, drafted a request for proposals, or an RFP, for the vendor to provide billing and coding auditing services. This was posted on March 4th, 2022 to the City Record. We're seeking a qualified vendor to conduct pre-submission billing and coding auditing services for inpatient, outpatient diagnostic and treatment centers, health home, home health, and skilled nursing facilities. Based on the evaluation committee's scoring of the proposals and presentations, KPMG was the winning vendor. Contract negotiations are currently in place, and we hope to launch that work by the end of October. On an annual basis, the OCC, in collaboration with the EITS department, conducts an annual HIPAA risk assessment with our vendor Coalfire. Coalfire conduct on-site and remote interviews. They conduct in-person and virtual walkthroughs of the system's facilities and clinics. They conduct risk and compliance reviews of applications and a sample of our vendors that create, receive, maintain, and transmit EPHI. And they also can perform penetration tests on our systems and applications to determine vulnerability or unauthorized access. Coalfire has completed its review of all areas with the exception of Gotham Health neighborhood and school-based health centers and the enterprise-wide assessment, which should be completed by the middle of November. And finally, every year, the OCC engages system workforce members to celebrate National Corporate Compliance and Ethics Week, which is from November 6th through November 12th. OCC staff will host both virtual and in-person activities, such as online games, webinars, and tabling events at some facilities across our system. In conjunction with National Corporate Compliance and Ethics Week, we are launching a workforce member survey regarding the compliance program. The survey is designed to assess workforce members' knowledge of the compliance program and their access to the OCC. Aggregated data of that survey will be used to determine whether there are gaps in the compliance program, and we will address those through a communication plan.
Okay. Are there any questions? I just had one comment that the billing and coding audit, once you've gotten to a point where you have a sense of the revenue, the cost of the audit and the time period for its implementation, we'd like to hear as soon as you have that information. Okay. Hearing no other questions, let me ask, is there any old business to be heard? Any new business? There being no further discussion, the meeting is adjourned. Thank you all.
Thank you.
This meeting is no longer being recorded.